Hello everyone, and welcome to this overview of this research poster presentation. This research poster presentation on behalf of the Renal Patient Support Group social media platform, and where this was works on sickle cell anemia, thalassaemia, and looking at bettering blood transfusion practices, and where this was a collaborative effort between uh, where this was a collaborative effort between postgrad students at an academic institution in the United Kingdom, and postgrad students who were particularly in around where they were students of pharmacology. And additionally, this was a collaboration between those in amongst where this was where this also had a sort of an external collaborator informally involved and sort of on behalf of the RPSG, the RPSG social media platform. So a bit of intro in around this research poster overview. So patient diagnosed with several chronic illnesses, or CIs, are often the most have been in amongst the literature have been in amongst the literature referred to as sort of intensive healthcare service users, because the needs are usually more complex than those of patients with single ailments. And it was forecasted that the number of patients or recipients with CIs will remain relatively stable over the ne- over the, sort of over the next sort of 5 or 6 years, at least where this in and where this research in around when this research poster presentation or the literature was sought for, in when this literature was sought in around from at the time. And that the and at the same time, although the number of recipients with multiple CIs has increased from from 1.9 million in 2008 to 2.9 million up to at least 2018. This consequently has impact on healthcare, on health and lives. And so with a growing older population, the prevalence in CIs or chronic illnesses again is a general concern, and the probability of recipients or recipients or patients having having with a growing older population, the prevalence of CIs or chronic illnesses is a general concern, and the probability of patients having further health complications can tend to also increase. And this can mean more recipients being admitted into hospital environs in hospital environs for particular aspects of healthcare. And in where, for example, where hospital admissions tend to by default require patients or recipients to also have their information in regard to their ABO blood grouping documented. And so, in context of sickle cell anemia, sickle cell anemic or thalassaemic patients, this also means where red blood cell transfusions tend to be part of a patient part of patient care and patient care and sort of treatment plans or care plans for those with sickle cell anemia and thalassaemia, and thus where such patients tend to require or may need specific or particular blood grouping and serological investigations to ensure that they are applicably sort of cared for through sort of such processes. So now I'm going into a little bit of in around hemoglobinopathies, and then a little bit about hematological challenges before going into some of the aims and objectives of this overview. So in around hemoglobinopathies, especially sickle cell anemia and thalassemia conditions, are conditions, and these are sort of genetic conditions um, that in severe forms are affiliated with chronic life-threatening diseases with inherent hematological pathophysiology that can affect well-being. So, for example, extreme pain, organ damage, and pulmonary complications, and these can lead to death or early death. And SCA or sickle cell anemia is estimated to affect 1 in every 2,000 live births in the UK or in England, and there are currently, or it has been documented or evidence that there are around 12,500 to 15,000 people with sickle cell anemia in the UK, and as such, it is one of the most common genetic conditions affecting people in the UK. And evidence also indicates that up to 100,000 up to 100,000 Americans have SCA, sickle cell anemia. In the US, SCA is sort of most prevalent amongst African Americans and occurs in about 1 in every 365 African American births compared with 1 in every 16 compared to in around compared to that 1 in every 16,300 Hispanic births and 1 in every 100,000 non-Hispanic and white births, and under certain conditions, individuals with SCA may require blood transfusions or red blood cell transfusions, particularly RBTs, or a series of transfusions, and these may be episodic or for treatment of acute, potentially life-threatening disease complications. For some individuals, a regularly scheduled and often lifelong chronic transfusions form part of primary care. So hence, as said as part of the intro, that RBT, red blood cell transfusion, and sort of serological investigations in amongst SCA and thalassemic recipients tend to be part of routine sort of care plans. Now going into a little bit around thalassemia. So thalassemia is an inherited red blood cell condition caused by quantitative defects in in the alpha and beta globulin chain synthesis, leading to a shortened red cell lifespan. So that is to say that the red cells themselves that have sort of that alpha and beta sort of chains or globulin chains, there the it is those elements of the alpha and beta globulin chains that are affected and cause a shortened lifespan to red cell and also red cell production. Additionally, thalassemia major is evidence that the more serious form of the disease, which results in a severe anemia, and patients who can unfortunately become transfusion dependent. And every year, about 10,000 young people are born with thalassemia major, accounting for about 10% of carriers globally. The condition also results in enlargement of organs such as the liver, the spleen, and bone expansion, and all of which occur as the body tries to compensate by expanding hemopoietic tissues into these areas of the body. The clinical severity of the SCA, sickle cell thalassemia, in line to thalassemia, is also varies amongst recipients, in part based on different genotypes. The most those with SCA genotypes, homozygous HBSS and HBS beta O or beta 0 thalassemia generally have more severe anemia and higher risk for severe complications than those with sickle cell anemia or SCA genotypes, for example, HBSC and HBS beta, SB positive or SB plus, HBS beta positive or HBS S beta plus and in line to HBS beta positive thalassemia. So now looking at some of the hematological challenges, in addition to some that have been mentioned in around sort of the generic elements of hemoglobinopathies. So some of the hematological challenges in this and in around this is where, despite the sort of therapeutic nature, red blood cell transfusion also carries its own risks of significant, potentially life-threatening complications. The most concerning of these is red cell alloimmunization, and where the immune system of a host can elicit a response post-transfusion, and where T cells and this T cells or T cells or white cells, or also known as lymphocytes, and these can cause a delayed hemolytic transfusion reaction upon subsequent transfusion, and iron overload. So hence as said as part of the intro again, where the treatment and care plans for those with SCA or thalassemia is where serological investigations form part of the sort of necessitating basis to ensure that such patients do not have or there is sort of a basis where such elements of those complications are precluded, if, for example, such patients or recipients have more than one red cell blood transfusion, and where red cell blood transfusion overload and red cell overload and iron overload can thus then cause more challenges, more harm than good in such recipients. So patients with SCA and thalassemia and specific clinical symptomologies may not be considered to have transfusion because of the alloimmunization, and so thus patients are thus so as such patients are and can be referred to as or deemed untransfusible. So in around the aims and objectives, or the aims at least in around this research poster overview, the work looks to highlight an overview of SCA, sickle cell anemia, and thalassemia to a better blood transfusion practices in patient populations. So now looking into looking into managing anemia. So, consistent with recent changes in perioperative transfusion practice, namely in the lowering of what had been was referred to in particular transfusion guidelines or transfusion medicine guidelines, is the transfusion trigger for red blood cells. One investigation found that anemia after major surgery is now a sort of a common occurrence, or can be a common occurrence, and consequently recipients who have undergone major surgery and were screened, 25% were found to have severe anemia on the morning post surgery, and with a hemoglobin concentration of between 70 or 90 grams per liter. And the team conclude this team the team concluding in around this particular investigation that early post-operative treatment with intravenous iron alone, or in combination with what's referred to as the erythropoietin, it does not appear to accelerate early recovery from post-operative anemia. So just to iterate in around this, listeners, is that the default practice would have transfusion practitioners have a request from frontline healthcare professionals to actually fulfill red cell blood transfusion requests on patients who have a low hemoglobin in for example in amongst major or in amongst sort of surgical conditions, in where patients have surgeries or surgical conditions, for example. However, at the same time, it is where in some literature, as in the case of where these investigators have found that there is literature to inform that, or investigations that inform that intravenous iron without red cell blood transfusion and a pharmacotherapeutic agent being erythropoietin, which is a subcutaneous injection that actually helps stimulate red cell production through the hormone, the endogenous hormone erythropoietin. The endogenous hormone, which is synthesized through the kidneys, and that being erythropoietin. And the short abbreviation of this particular pharmacotherapeutic agent is retrospectively is referred to as EPO. However, EPO and intravenous iron in such patients does not or has not been identified to actually increase entirely sort of in around the sort of low hemoglobin levels in such patient populations. And so, unfortunately, at present, little research has been conducted additionally to explore or investigate or replicate this one particular investigation, to establish whether managing anemia in chronic illness in the chronic illness or untransfusible patient in chronic illness or untransfusible recipients in the same manner or basis that would be advantageous. In the same manner, or on the same basis, which would be advantageous, where such prospective research is sorely required to investigate sort of comparisons between different forms of managing the low hemoglobin in chronic illness populations, but in particular, and particularly in those with SCA, sickle cell anemia, and thalassemia. Another investigation retrospectively examined association of EPO use with hemoglobin recovery in low hemoglobin and transfusible in a low hemoglobin and low hemoglobin hospitalized recipients. EPO treated patients were identified through the combination of retrospective case reviews and systematic reviews. And literature reports of untransfusible patients not treated with EPO were used to as a comparator cohort. Investigators established in this particular investigation that hemoglobin recovery was higher in recipients with lower baseline levels, and irrespective of EPO use. Irrespective of EPO use, there was no association. No association was identified between the rate of hemoglobin recovery and EPO use. And so dose or therapy, in the rate of hemoglobin recovery and EPO use, dose and or therapy duration. In anemic, untransfusible hospitalized recipients or patients, EPO was not associated with an increased hemoglobin recovery. At the same time, the investigation did not include sickle cell anemia and thalassemia cohorts as untransfusible patients. Now, that is to say that the investigators in this particular works, or the in that particular research works, it was where the investigators did not include a cohort that was specific to those who were suffering with SCA, sickle cell anemia, and or thalassemia to actually to deem sort of comparisons, and so this then has meant that this by if they have been included. Sorry, to iterate, if SCA and thalassaemic recipients had been included in the investigation, it may have provided some important insights on how to offer transfusion practices in patients with such hemoglobinopathies. In this research poster presentation, there is an illustration which had been had been adapted from an online website or page in around a sickle cell anemia morphology, and in this in the morphology of sickle cell anemia, you can see here that the red cells are not concave or not of regular concave shape, and you can see that there is sort of where the red cells are sort of delineated and sort of additionally where in amongst laboratories, or where laboratory practitioners would look to assess or identify, they would refer this to where the morphology shows sickle cell anemia in sickle cell crises. So you can see that the red cells are not sort of regular concave shaped as they should be under normal morphology. So now looking a little bit in around red blood cell transfusion practices. So transfusion practices are advancing, or have been advancing, incorporating many novel pharmacotherapeutic agents into healthcare in view of the potential side effects of, for example, red blood cell transfusions or whole blood. There is never there is ever so at the same time there's ever more need to consider the synthesis of the endocrine or hormone EPO or erythropoietin, and wherein a sickle cell anemia and thalassemia carriers can have this sort of synthesis defect. And although risks are important in the use of EPO as a pharmacological intervention linked to varying pathophysiological conditions, this has also led to a re-evaluation of the criteria for the use of the use of whole blood or red blood cells for transfusion. However, transfusion practices have not been have not been modified or had a modified approach due to the fear of the mortality or morbidity relating to the anemic symptomology, especially in untransfusible recipients and/or patients at risk of developing complications. That is additionally to say that that red cells, because of red cells and their sort of therapy, their sort of efficacy in context of red cell, in context of their their oxygen carrying sort of a basis. There have not been investigations or many investigations that look to compare different pharmacotherapeutics aligned to whole blood, simply because blood or red cells or whole blood generally are those is a pharmaco is a form of treatment that has the efficacy of ensuring a sort of ensuring increasing red cell homeostasis throughout pathophysiology, whereas with EPO, it is a pharmacotherapeutic agent which requires, for example, normal or where normal requires a basis of general normal hematology, and additionally where, for example, there is where there is where there is where in the hematology there is normal a normal systemic red cells, normal red cells generally, and thus in the case of SCA recipients and thalassemic patients, this systemically the morphology, the blood morphology is and would be similar to that of what's shown in this in amongst the sickle cell morphology illustration in on this research poster presentation. And additionally in around this in around this the ability of transfusion to facilitate the transport of oxygen from the environment to from the environment to mitochondrium has been repeatedly demonstrated in physiology research, and the physical characteristics, again the physical characteristic of red blood cells or RBCs and properties allow the solubility of plasma for oxygen by an estimated 30-fold. In addition, the affinity of red cells for oxygen is modulated by regional acid-base conditions to favor oxygen loading. Again, EPO does not, erythropoietin and even iron infusions in sickle cell thalassemic patients, sickle cell anemic patients and the thalassemic recipients does not guarantee sort of the oxygen load, and the affinity for red cell production post red cell transfusion. Sorry, post EPO use, for example. So the oxygenation in around blood is has been evidenced to help increase around 30-fold in the use of red blood cells. In addition, again, there is that affinity between that oxygen being modulated by the acid-base conditions that actually also favor the oxygen loading, and it is this that also helps with this that also helps at the at pathophysiological level and tissue level. At present, there are no real clinically available fluids that have the loading and unloading and carrying properties of whole blood or whole blood and red blood cell transfusions in context of red blood cell transfusion. In this second sort of illustration or figure, there is a look at thalassemia morphology, and the morphology shows a peripheral blood under microscopy showing blood showing a blood smear showing SCA poikilocytosis with a microcytic hyperchromic morphology and nucleated red cells or NRBCs, and what are also referred to as Howell Jolly body sort of cells, and some of the red cells also show, or some of the red blood cells in this schematic or this illustration in thalassaemic morphology also show a dyserythropoiesis, which is where the morphology shows that there is a lack of red cell stimulation, and where the red cells appear more abnormal or smaller, and less concave, again, much like the sickle cell morphology in some regard, but in regard to the nucleated red cells or NRBCs, you can see these which have sort of arrows pointing to them in this thalassemia morphology, figure, and there is also where the microcytic hypochromic morphology is where the red cells will appear under microscopy, sort of where they have a sort of a shiny shiny tinge to them, meaning that the red cells are not or do not have the efficacy or affinity to carry to help with sort of oxygenation. So now looking at sort of the conclusions, some of the conclusions. So in untransfusible recipients, in context of CI recipients or chronic illness recipients, and amongst thalassaemic sickle cell anemia recipients, it is still to be piloted through sort of large-scale trials or investigations as to whether EPO has advantage over red cell blood transfusion, especially in patients who might be at more risk of transfusion-like reactions. So while trends in clinical management do follow sort of updates in treatment and guidelines, there is still delayed uptake of guidelines and recommendations across SCA or sickle cell anemia practices. And whilst the synthesis of EPO may not be compromised in SCA recipients, this can potentially affect a patient's overall hemoglobin. Um, and remember, listeners, that that red cell transfusion in sickle cell anemia recipients or thalassemic patients is primarily used to increase the hemoglobin and in around the hemoglobin, and it is the morphology in this research poster presentation shows where the red cells are degraded, or there's degradation, and with more transfusions, for example, the condition actually can actually worsen or be more challenging to manage, and there is therefore a requirement for sort of a for and against the debate regarding transfusion and how care is managed and practiced for SCA and for sickle cell anemia and thalassaemic recipients, particularly particularly also in surrounding, although the research poster presentation had not focused on it, on another element, and that is to do with estimated glomerular filtration rate, which is the calculation used to determine renal function. And since red cells are stimulated or are stimulated through the kidneys by and through the hormone erythropoietin, there have not been many investigations or studies that actually look at the importance of renal function or renal insufficiency or estimated glomerular filtration rate. So this sort of collaboration, this collaborative effort in around this research poster presentation had looked to also highlight, at least from some bases, that feasibility in pilot and longitudinal investigations are required or needed, that look to compare different forms of treatment alternatives in a group of those with chronic illnesses, LCIs, and sickle cell anemia recipients or patients who are routinely prescribed red blood cell transfusions or RBTs, and wherein EGFR is also factored to understand if recipients may advantage from alternative treatment modalities. So that draws this draws this sort of overview of this research poster presentation, and to an end. This has been a research poster presentation overview in looking at sickle cell anemia and thalassemia and sort of bettering blood transfusion practices. There is some citations and references that listeners can refer to identify similar works in around the theme of this research poster presentation. Thank you.